Has your baby or toddler ever suddenly refused to nurse for a period of hours or days and you were worried that they were suddenly weaning? Were you worried about your milk supply and thinking that this was the end of your feeding relationship of breastfeeding or chest feeding? Today's episode is all about nursing strikes and how you can continue your nursing relationship if a nursing strike were to occur. So grab some coffee or some tea or tune in while you're driving or washing the dishes and let's get right to it. When I began breastfeeding, I was blindsided by how difficult it was. I may have thought I was prepared, but having known only a handful of people who had ever breastfed and only seeing it up close from a couple of them, I had a huge learning curve. Since then, I've become a doula, a lactation consultant, and a childbirth educator. I'm your host, Lo Nigrosh, and I welcome you to the Milk Making Minutes, where we explore breastfeeding experiences through the lens of systemic barriers, so that you know your breastfeeding struggles are not your fault, and your triumphs really are the miracles you feel they are. I often have clients contact me and they're really worried because their baby is refusing to nurse for some reason, or they think their baby is weaning. And they don't really know what to do because they don't want to switch to formula or they don't have a big enough stash and they're trying to figure out how to navigate this situation. So typically, the numbers vary in various texts. So some say if your baby is under 1, then they are definitely not weaning. And other texts say if your baby is anything under 24 months, they aren't really weaning and it's considered a nursing strike. That probably varies temperamentally and depends on how much nursing you do. But either way, if it's sudden, you can bet that this is what we consider a strike and not weaning. And this can be the result of multiple factors. So, when we're looking to see why is a baby suddenly refusing nursing, it could be the result of physical causes or it could be the result of environmental causes. So the physical causes could be things like maybe baby is coming down with something, maybe they have an ear infection or some kind of cold, maybe they are teething and it's making it difficult for them to nurse. They could be dealing with something like acid reflux. You would have some other symptoms as well. They're spitting up, or maybe some colicky behavior. Or if you have lots of milk and you can really feel your milk coming in strongly, it could be that you have an overactive letdown. And so then, right there at the beginning, you have a lot of milk coming in. And so now they're refusing to latch because it's hard for them to manage that flow. It could be that they have a sensitivity to a food or an allergy or an intolerance. And so that's troubling them. And so they have now associated pain with your milk and they have gone on a strike. If they have had an injection or they have rolled over and there's a crick in their neck, and so now the positions are making it hard for them to nurse, it could just be that it could be painful. There's some sort of painful positioning that makes it tough. They could have thrush or some sort of injury going on in the mouth, hand, foot, mouth disease. If they go to daycare, they could have picked that up. And so if there's a blister or something in their mouth that's painful for nursing, then they could be refusing to nurse. And if some babies are really sensitive, if you've changed your deodorant or you are wearing a new lotion or a new scent and they're not liking that, then they could be refusing to nurse, or even a new laundry detergent on your clothing. They might not like that. And so some babies are just more sensitive than others about things like that. Or there could be something environmental going on. So if there's some sort of overstimulation happening during nursing, they could decide that they're not enjoying that time anymore and could be refusing to nurse. If you have been feeding on a strict routine and it feels stressful to them, then they could refuse to nurse. So, if there are frequent interruptions to nursing, that could become stressful, or if there are timed feeds, that could become stressful and they could refuse. If the baby has been left to cry for long periods of time, they could become overstimulated and now they're refusing to nurse as a result of that. There have been any major changes in the baby's routine and they're a sensitive baby, like if you've been traveling or you were on a plane or it's the holidays and so your typical routine has been disrupted, sometimes that will result in a nursing strike. If there have been any arguments during nursing, any kind of yelling or tenseness during nursing, for some babies, that can really cause nursing strikes. There are some studies to show that during nursing, if your cortisol spikes, that can spike cortisol in your milk, which results in higher stress levels in the baby. And so then they will feel stressed out. And so their natural response will be they don't want to be stressed out. And so they might not want to nurse during that time. So even if you're having like stressful conversations on the phone or texting at that time and you get stressed out, that could really interfere with the baby energetically, believe it or not. If your baby has tried to bite you and you had a strong reaction, naturally, many of us do the first couple of times that might have happened, might now not want to nurse because of that strong reaction. Or if there has been an unusually long separation. So maybe you had a couple of days where you worked really long and now they might not want to nurse. So there might be a nursing strike as a result. So those are some reasons why nursing strikes might happen, but you can reestablish nursing if that has happened. There are some people who used to think, oh, I'm just going to wait baby out. They'll get hungry eventually and they'll eat. Well, you definitely do not want to wait baby out. Feed the baby. First priority is to feed the baby and protect your milk supply. Continue to remove milk in whichever way you feel most comfortable, whether that's hand expression. I have a great episode on hand expression that one of my favorite people, Francie Webb, recorded with me for a quick hit episode. I'll have that linked in the show notes. Or you can pump. I have several pumping episodes that I'll have linked in the show notes as well. So be sure to refer to those if you want to maintain your milk supply by pumping during the refusal time. Make sure your phalanges are fitting well. Some suggest that you avoid feeding the baby in a way that satisfies the baby's natural urge to suck. If you can avoid feeding the baby using a bottle, then that might resolve the strike sooner. You can use a spoon if the baby is really young and they're taking in really small quantities at a time, or a syringe, or if they're a little bit older, using an open cup is fine in an upright position so they're not choking, or a cup with a straw or a sippy cup, so that natural desire that they have to suck will be extended towards you and your body. What can you do to get them to want to come to you and nurse? You want to decrease the stress levels at your body as much as possible. So make sure that when they're with you and on your body, that it is a low stress place to be. Lots of cuddling time, lots of skin to skin time as much as possible. So I often encourage my clients, if they can, to get in a warm bath with their babies and just have a nice snuggly bath time, skin to skin. That will often encourage a nursing session. So bath time is a great place to encourage some nursing during a nursing strike. Spend time just touching in skin to skin contact. attempt nursing while baby is in a drowsy state or a sleepy state, you can top the baby off first. So make sure they're not super hungry when you attempt nursing. So give baby a little bit of food and then attempt to nurse. Feed in upright positions and then use pillows for support. So if baby is a little bit older, you may have been nursing in lots of positions. Go back to your basics. Try your sideline positions again. Try your basic laid back positioning again and see if that will help. You may need to reach out to an IBCLC and get fitted for a nipple shield for a little while if there's something going on in baby's mouth that's making it difficult for them to nurse. But I wouldn't just go out and buy a nipple shield. I would get fitted and I would get the help of a provider in IBCLC and see if that could be a tool for you. Try nursing in motion. So sometimes just rocking or walking while you're nursing could be helpful. A carrier is a really great tool for that. And someone I like to follow on Instagram for nursing in a carrier is an account called Let's Talk About Baby Wearing. She has lots of great tips for nursing in baby carriers. Spend as much as time possible nursing. So do what we call a nurse in on your days off. Just spend as much time around the house nursing. So I know this can be really hard if you have older siblings, but if you can just cancel plans, plan some movie days for your older kids, they'll love it. Just have snacks and popcorn and all the treats they don't normally get, and make it a fun time for all the kids if you can, and spend that time just all together as a family. You can try dripping expressed milk on the nipple to remind them what a great place it is. If the nursing strike is as a result of an overactive letdown or too much milk, you can go ahead and express the overactive letdown into a cloth or into a bottle first, so they're not having to fight that fire hose spray coming at them. Use all the positions that you know your baby has traditionally liked best. You can also try a nursing supplementer. So if it's as a result of undersupply or baby feels like the flow needs to be faster, nursing supplementer is a silicone tube that you can attach to your nipple with a little supplement on the side, either a formula or of your own milk. And it allows for a little more milk to be coming at the same time as what's in your body. And it allows for the baby to be stimulating your nipple while they're taking this supplement at the same time. So it could be increasing your milk supply. So these are all tips to try to help your baby through a nursing strike. And as I said before, nursing strikes last typically no longer than 10 days. And you can work through this for about 10 days. And if you feel like you've gotten to the 10-day mark and you have not had success, reach out to an IBCLC, and I would love to be the IBCLC who supports you through this. You can find all of my information on my website, www.quavinbirthservices.com. If you are a provider, a doula, a chiropractor, a dentist, another IBCLC who has found my podcast useful, who has been listening, and you are someone who is exasperated with the state of healthcare. You are somebody who knows that feeding our babies should not be as difficult as it is, and you want a community of people who is talking about how difficult baby feeding is. Join my Milk Making Minutes community group on Facebook. That's what that group is for. It's not an asking questions and answering them group on Facebook. It is all about exploring the inequities that exist when it comes to feeding our babies. The cultural barriers that exist, all the barriers that are there that make feeding babies difficult. So I would love to see you join that group as a professional trying to make it better. See you there.